Good morning and welcome to the Addictions and Employee Wellbeing webinar today, the 26th of November. My name is Genevieve Glover and I'm Managing Director of Maudsley Learning. Maudsley Learning provides and supports world-class and accessible learning in mental health and wellbeing. We are a subsidiary of the Maudsley charity and we're part of the King's Health Partners family. I'd like to welcome our two speakers today, Don Shenker, who's Director and Founder of the Alcohol Health Network, and also Dr. Jane Marshall, who's a consultant psychiatrist and senior lecturer in addictions at the South London and Maudsley NHS Foundation Trust. Before we go into the detail of the webinar, I'd just like to give an initial introduction, but also the learning outcomes that we're hoping that we will achieve as part of the webinar, and then I'll hand over to our speakers. Current research seems to show that the use of illegal drugs while at work is very low, although the impact on workplaces of individuals who do can be extremely damaging. Among people who are at work, the use of prescription drugs is much more common. An estimated 1.5 million people are addicted to prescription and over-the-counter drugs in the UK. The biggest addiction problem in UK workplaces by far is alcohol misuse. Indeed, 60% of employers say they have experienced problems due to staff drinking alcohol, and it's estimated that between 3 and 5% of all absences are lost each year due to alcohol, which equates to about 8 to 14 million lost working days in the UK each year. Addiction and other mental health issues result in lost time, poor quality work, and on-the-job injuries, which affect productivity, employee morale, and ultimately the profitability of your business. But it's not just about protecting levels of productivity or managing alertness. It is also about employers assisting any employees who have a drug or alcohol problem. Using a case study approach, this webinar is aimed to help HR or occupational health professionals or line managers in early detection of performance or personality changes and to be aware of the need for help. What are the signs? What you should do if you detect a problem? What are your obligations as an HR or occupational health professional or line manager? And what tools and resources are available? And what are the benefits of collaboratively working with an employee to seek treatment and return to the workplace? To you as the HR professional, line manager, but also to the employee and the employee's co-workers. This network was set up in 2012, recognising that evidence-based practice in primary healthcare could be used to benefit workforce and public health in the public and private sector. Don has over 20 years' experience in the alcohol harm reduction sector as a policy analyst, government advisor, research manager, and addictions counsellor. He is recognised as one of the foremost policy experts on alcohol issues in the UK. As director of the Alcohol Health Network, he currently advises the Health at Work subgroup on alcohol for the UK Public Health Responsibility Deal, led by Dame Carol Black. Don has also led Alcohol Concern as their CEO from 2008 to 2011 and was its Director of Policy from 2005 to 2008. Prior to this, he worked in clinical addictions practice as a counsellor, manager and director. He has advised several clinical research trials on alcohol, including the SIPS trial, Kana et al. 2012, and the Down Your Drink trial, Wallace et al. 2011. Don was a member of the 2009-10 NICE Guideline Development Group, which produces the public health guidelines on preventing alcohol harm, recommending greater use of IBA, which is Identification Brief Advice, in health and non-health settings. He has been a regular advisor to the Home Office, Department of Health, and Ministry of Justice on alcohol issues. He was a member of the Executive Board of the Alcohol Health Alliance between 2008 and 2011, and he became a Fellow of the Royal Society of Public Health in 2003. Now, Don will be taking us through a case study, and if you look to the top right-hand side of your screen, you need to download. I'll now pass you over to Don.
Right, sorry, apologies everyone. Thank you, Genevieve. I'll start again. Thank you very much. It's a pleasure to be here. AHN, or the Alcohol Health Network, is a social enterprise. We aim to support employers and employees to reduce alcohol harm via the workplace. We develop alcohol awareness campaigns for all workplaces and provide training for managers to address alcohol issues amongst their employees. We also provide online self-assessment tools and paper resources to raise self-awareness of drinking levels and risks in workplaces. We're going to be looking at a case study today. I'll go through the case study and look at the implications on, of addiction on safety, productivity and employee well-being. We'll look at what the signs of alcohol misuse were in the case study and what the manager did and didn't do to address that issue. And this will help us look at what the impact of alcohol misuse is on the workplace and the role of line managers. And then we'll also look at some simple steps organizations can take to provide and promote support that's available, making it much easier to approach employees who may be struggling with an addiction problem. So the case study is with Amber. Amber is described as a hard-working, diligent, and professional individual. However, after a year or so, she's begun to arrive late to work and has been frequently off sick. Her sickness and lateness is beginning to impact on her colleagues. She's also looking a bit red in the face and a bit slow in her responses in the mornings. And although she often makes up her hours working very hard, she's also quite inconsistent. She then begins to ask colleagues to lend her money, and she begins to lose her temper with clients on the phone, which is not a good thing, obviously. So all this comes to a head one night when Amber's manager, Liz, finds her drinking at her desk, and Amber puts this down to simply finding some leftover alcohol from the Christmas party. Liz doesn't challenge Amber at the time. She does get hold of some leaflets from her GP surgery on alcohol, and she leaves them for Amber on Amber's desk the next morning. Amber hides the leaflets away when she sees them, and then continues to repeat the pattern of sickness and lateness. Finally, Liz has enough of this, calls Amber into her office and tells her that her drinking is a problem. She clearly has a drink problem, and that it has to stop. Amber is quite defensive with this intervention, and she resigns the next day. So I think this case study offers some opportunities to look at the role of the line manager quite closely, and we could review how Liz handled the case and whether she could have done anything different. Now, if Amber is struggling with her drinking, she's not a unique case. Around 10 million people in the UK drink in ways that are harmful to their health. Around 7 million people, that's 17% of the drinking population, are drinking at increasing risk levels, which will impact on their health and their physical health and their mental health. Their drinking problems may not manifest themselves in the workplace very obviously, but they eventually the level of drinking will potentially have a problem. It's estimated that around 25% of also a large workforce will simply mirror the national picture. So around 25% of large workforces will be drinking at either increasing or high risk levels. The extent to which drinking excessively impinges on work performance is largely down to the individual. So many people can actually continue to work fairly consistently without their heavy drinking having an impact. But of course, problems may well present themselves. And many workplaces actually tolerate heavy drinking and see it as fairly normal. And in my next slide, we look at a sort of a normalized workplace culture. Alcohol is the most widely used substance amongst working adults. Almost 80% of risky drinkers are employed, as I said, and a recent YouGov poll found that a third of employees admitted having been to work with a hangover, and 15% admitted having been drunk at work. So we know through general lifestyle surveys that 1 in 6 employees will have a substance misuse and or a mental health problem. And as Genevieve says, the impact on the economy is quite huge. Alcohol misuse costs employers £7.3 billion per year, according to the Home Office. So the impact of heavy drinking on the workplace is that heavy drinking is actually associated with multiple negative workplace outcomes. There is a direct correlation between the amount of alcohol consumed and increased presenteeism, not just absenteeism, but presenteeism, as well as higher rates of absenteeism. There is a direct correlation in terms of accidents, reduced academic performance and work performance, and also the increased risk of unemployment, as well as premature mortality. So the important point is that even when drinking outside of work is not impacting on work itself, it's still certainly impacting on physical and mental health. And this obviously has consequences in terms of people's ability to work well, even when performance is not an issue. So how too much drinking affects health and work performance is my next slide. Time off work due to hangovers or feeling unwell in the morning is a classic example. We know that excessive drinking affects sleep, and poor sleep obviously affects work performance. And consistent long-term drinking will certainly increase the risk of issues such as heart disease, cancers, liver disease, and this will have an impact on physical health, obviously. There's also an issue in terms of drinking problems beginning to affect the whole team. If someone is drinking a lot and they're concealing it from their colleagues, or if colleagues are aware of it but tolerate it to a certain extent, this obviously can cause stress and tension for the whole team. So the role of line managers in terms of HR professionals or OH professionals, as I see it, is quite crucial about the employees' well-being. So it's the employer's responsibility, I think, to take action both proactively and preventatively, and also in terms of dealing with any issues. And so, you know, we have a duty of care to every employee to help them look after their health, and it's good practice now in many organizations to have certainly to have a policy in place on alcohol and drugs in the workplace, and for that policy to state that the company or the organization will support any individual who discloses any difficulties. So certainly in the safety critical industries now, there's a very clear policy that people who come forward to disclose any difficulties they have with their alcohol use or even drug use will be treated favorably. They won't lose their jobs. They'll be provided with lots of support to help them overcome those difficulties. And the second point around policy, good practice, I think, is to treat the alcohol issue itself as a sickness or a health issue, not a disciplinary issue. And this is certainly something which is recommended by the Faculty of Occupational Medicine and the Health and Safety Executive. So alcohol misuse needs to be seen as a sickness or a health issue. And this is where self-assessment is quite important. Alcohol awareness programs can encourage self-assessment so that employees for themselves can see if their drinking is a problem, and they can use a wide range of self-assessment tools to look at their drinking and to take any action that's required. And I think it's good practice for employers to make those resources available and to signpost to services that exist. So when approaching an individual as a line manager, I think it's the personal attitude and the degree of empathy from the line manager which will determine the employee's response. In the case study, when Liz accused Amber of drinking without really wanting to hear Amber's side of the story, that obviously made Amber quite defensive. We don't actually know what Amber's drinking history is. We don't know why she was drinking in the way she was. We don't even know whether she had a drink problem, but essentially it looked like there possibly was a problem there. Unfortunately, the way that Liz confronted her, I don't think helped very much in terms of that particular situation. So I think the line manager needs to state some of the facts and the risks, but needs to give the employee the opportunity to seek help. So needs to give the employee the opportunity to explore some of the problems. And reinforce the fact that the organization will support the employee if there is a problem there. So in terms of the case study, I think a different approach might have been for the manager to possibly explore the problem, to simply ask Amber whether she thought she might have a problem with her level of drinking, whether her level of drinking was impacting on her life or her work, to be open about Liz's concerns, and to offer support to specifically say that the organisation is there to help Amber if she wants some support around any concerns that she has, and to some extent to sort of make it less of a stigma to say that that people often get into difficulties with their drinking. It's very easy to lose track of how much you drink and to use alcohol as a crutch in certain cases, or to use it to deal with particular problems of stress, home life difficulties, work difficulties, but that many people can learn to cut down. And those sort of comments, I think, are much more likely to elicit a positive response from employees. So, it doesn't mean that the manager can't also state some of the managerial concerns, and if drinking does become a problem, I think they can say, well, if we don't deal with this, then we are going to have to look at the situation again. But at least the offer is there to questions.
Fantastic, thank you for that, Don. As Don mentioned, we are going to be taking questions for both of our speakers, so I actually have a couple myself, so I will ask those while your questions come through, and then I will put them through to Don before we hand over to the next speaker. So while those questions are coming through, Don, we talked actually before we went online for the webinar that there are some environments where there is a culture of drinking socially. There's a culture where one drinks with clients as part of business development, client account management, etc., which clearly has an impact on individual alcohol consumption. I mean, how can those environments can be changed where the more positive approach to alcohol and perhaps less reliance on those that approach within that sort of environment?
Well, I think the key thing is to have a statement of principle within each within a company policy, and that company policy has to be well communicated to all individuals, both at induction and throughout the year. So I think a good policy will say that no drinking on the job is tolerated, that employees are not allowed to consume alcohol while they're working, and to state what the parameters of that is. So essentially, when people are at work, that they should not be under the influence of alcohol. Now, the difficulty could be where a part of the job is actually entertaining clients, for example, in the financial world, for example, that's very common. And there, I think there needs to be some particular guidelines in place regarding what is acceptable. And it may be the company makes a decision that a moderate amount of alcohol sticking to government guidelines amongst any employees is acceptable. But to make it very clear what those guidelines are, and to really have a think about internally about what that might mean and what some of the consequences might be for people who go above those guidelines. So I think it's looking at acceptable behaviour, but on the have a very clear policy that this is an alcohol-free zone when you come to work, if you like, and you need to be fit and well to do your job while you're at work. So I think in answer to, in terms of changing a culture, I think it's about having a clear policy which is well communicated, and even just having those conversations at an internal senior manager, middle manager, and sort of junior and more sort of wide level starts to raise understanding of what some difficulties might be in terms of this issue, and create a different culture in terms of alcohol in the workplace.
I mean, that's quite useful. I think, as you say, clarity of expectation, perhaps senior managers role modelling the expectations as well. And also, one of my next questions was really around sort of signposting support. Some organisations do have occupational health support, they have HR departments, they may have enlightened line managers. What about those organisations that don't have any of those? Where would you signpost them to be able to gain sort of low, no-cost access to information and support?
So there are many online resources that managers can signpost people to, that employers can use. The NHS Choices website has a lot of information on alcohol. There's also an NHS Live Well website which has a lot of information, and they have resources on there which you can download. They even have the self-assessment tools that people can use to check their own drinking for themselves. the specific screening tool, which Jane will talk about in her presentation, is on some of those websites. So there are free to download websites that can be used. Mostly, I mean, I'd recommend the NHS ones essentially, and they don't cost anything. It is a problem that many workplaces want posters and leaflets and so on, and they're not always freely available, and that is an issue which I think someone in government should have a look at. But I mean, essentially, there are at least online resources that can be used. In addition to that, it's not difficult to find as an HR manager or an occupational health manager where local alcohol services are. The NHS Choices website has a Find a Service directory which will tell you where your local alcohol service is placed. They'll have contact details, and some of the self-help groups such as Alcoholics Anonymous and Smart Recovery have their own websites that will be able to pinpoint exactly where those groups take place. So it's not too difficult with a little bit of research for an HR manager.
Fantastic. And just obviously the case study with Amber was very helpful to sort of consider the different perspectives, both from the line manager but also from Amber's. If we take that a one step further, and the line manager has approached it in the best practice way that you suggest, it's been established that Amber does have an alcohol problem. How does Amber's line manager prepare the team to support Amber with this problem? How would you suggest that they go about that?
Well, if Amber's being open about her problem and stating that she needs support, and that might be some counselling support or some self-help support, I think essentially it's again about having an open conversation in the team about the relationship that everyone has with alcohol, and it may be that team members are are able to be more sympathetic and empathic to someone who has a drink problem simply by being aware of that, and they may not go down to the pub after work so regularly, or invite Amber to the pub regularly with them if they know she has a drink problem. There may be a more open conversation about doing alternative things like going bowling or going to the cinema instead. It doesn't have, after work activities don't always have to involve alcohol. So I think it's just about having open conversations. There are, many people in the country who don't drink for various reasons, and some of those people will have had drink problems in the past. And I think just being open with individuals about their situation means that people can have grown-up conversations about how to support that individual. I mean, in terms of Amber's ongoing support, it may well be that the line manager wants to have ongoing conversations with Amber about how she's getting on in terms of her drinking. If she is dependent on alcohol, she may well want to get some counselling support. And good practice would dictate that the line manager and Amber have a ongoing sequence of conversations about how Amber's doing, if there's any stresses at work that the manager can help with in terms of possible impact on Amber's on Amber's stress, if you like, and if that's a factor. So whatever the employer can do to support Amber to deal with her drink problem is the right thing to do. And likewise, Amber needs to be open about any difficulties she's having and do the best job she can to overcome her drinking, but also to be good at her job.
Yeah, no, that's very helpful. I think the key point that you mentioned at the beginning of your response around the fact that it really does depend on how open Amber wants to be with her colleagues. And of course, you don't have to tell the full story, but perhaps just enough so they can provide that initial framework to help her not only look after her sort of physical and mental health, but also to be a sort of productive contributor to psychiatrist and senior lecturer in the addictions at South London and Maudsley NHS Foundation Trust. She's been with SLAM and the National Addiction Centre in London since 1994. She is clinical lead for a specialist outpatient consultation and treatment service for addicted healthcare professionals at SLAM, and also does clinical sessions at the Practitioner Health Programme. Jane is a consultant advisor to the Civil Aviation Authority and a medical supervisor and examiner for the General Medical Council. She is a founder member of the Psychiatrist Support Service at the Royal College of Psychiatrists and still sits on this committee. Jane remains active in the teaching and training field with a current focus on addiction in healthcare and allied professionals and in the workplace. And Jane will be speaking about the role of the workplace in supporting workers with alcohol and drug problems to seek help and tackle the problem effectively. Over to you, Jane.
Thank you very much, Genevieve, for that very nice introduction. And it's a real pleasure to be involved in this webinar with Don, whom I've known for a number of years, particularly when he worked in CERN. Just moving on to the next slide. How might employers support employees with an addiction problem? In my presentation, I'm going to explore what addiction looks like in the workplace, give some definitions, introduce you to the audit questionnaire, and highlight the benefits of treatment for both employer and employee. And really, the focus of my presentation is the fact that the workplace is an appropriate venue for health promotion and for the identification of addictions. This slide goes over some of what Don has already mentioned, the effect of addiction on work performance and productivity problems. And we've heard about absenteeism, poor decision making, through to inconsistent performance, and the fact that there are more accidents when there are people with alcohol and drug problems in the workplace. In fact, up to 40% of accidents at work involve or are related to alcohol. And we know that alcohol causes impairment in thinking, concentration, judgment, and mood, really aspects of the person which are very important in interaction in the workplace. So what does addiction look like in the workplace? Well, Don mentioned the YouGov study, and in this particular YouGov study, there were interviews carried out with individuals who said that they often came into work with a hangover, particularly after a weekend of heavy drinking, and they described themselves as drifting off at work, having headaches, not concentrating, and actually not working at their usual pace. As problems with drug and alcohol become more serious, so that one observes deteriorating skills, you might come into work and find somebody asleep at a desk. They might not have left the office all night. And there are obviously interpersonal difficulties. These may be very subtle, and it might not be evident initially that alcohol or drugs are at the heart of the problem. Workplaces will often have indices like sickness absence, particularly on Mondays, which give a sense that there might be a problem with individuals working in the workplace. Rates of productivity, accidents, and disciplinary sorts of indices and identify people with problems at an earlier stage. We know from the Office for National Statistics and the General Lifestyle surveys that the employed population is more likely to drink than the unemployed population. And this is a table from a BMA report published in February of this year, really worth a look, and the reference is at the end, which clearly shows that those who are in employment in Great Britain do drink more frequently than those who are unemployed. And they are indeed drinking about as heavily overall, but there are more of them drinking. And this next table shows that those in managerial and professional types of work are more likely to drink than those in routine and manual work, which probably is and you might think that is counterintuitive, but it's very interesting to see these data from the General Lifestyle Survey overview. So in the workplace, what are the situations associated with problems? Well, there will be some types of work which are at risk, individuals working shifts and at night, whom they may be less supervised and be able to drink quietly. Those who travel away from home, I do some work with the Civil Aviation Authority, so pilots are away from home some of the time. That puts them at risk. Working remotely, it sounds good, you may become isolated, however, and begin to take a drink at lunchtime or earlier in the evening. Then there's the hospitality industry or people in the city who are using meals and alcohol to clinch deals, and this is a clear risk. Job stress is important, and there is international evidence that hours, long hours, are important. Workplace culture actually can bring factors to this problem, and there will be pressures perhaps in certain workplaces that put people at higher risk of developing an alcohol or drug problem. Availability of alcohol, particularly, for instance, in the drinks industry or working in breweries. Peer pressure is important, and sometimes workers don't quite know what to do, so will collude. Lack of supervision ambulance staff, people who are coming into contact with the public on a day-to-day basis, and sometimes if there's a demanding or aggressive public, they can be more at risk. There are data from mortality statistics which show that those working in the drinks industry actually have the highest risk of alcohol-related deaths. And as you might expect, the highest mortality from illicit drug dependence and accidental poisoning is the literary and artistic occupation, but also construction industry trades. So what is an alcohol unit? Well, it's very important to be aware that there's about 10 mils or 8 grams of pure alcohol is a unit, and this is equivalent to about 1/3 of a pint of ordinary strength beer or half a standard glass of wine. And indeed, this is 12% alcohol by volume wine. Increasingly, wine, particularly from the New World, is 13% or even up to 15%. So it's very important to be aware of what is in your drink. We should know our units, and women should drink no more than 2 or 3 per day, and men should drink no more than 3 or 4 a day. And we shouldn't save up all the allowance and drink it at once. Great Britain is a binge capital and of the world possibly, and we can see this on our streets on Friday and Saturday nights. Definitions. What I'm going to take you through is just some brief definitions of hazardous drinking, binge drinking, harmful drinking, and alcohol dependence. Clearly, this type of drinking is on a spectrum, and what you will see in this triangle on its side, it shows you the spectrum, but also the proportions of people who are drinking in a hazardous, harmful, moderately dependent, and severely dependent way. In the workplace, we are going to be seeing people who don't drink and people who are drinking at the hazardous and harmful level. There will be certain people drinking at the more severe level, and there will be different interventions for these groups. So at the low risk end of the spectrum, these men will be drinking less than 21 units harmful drinking, and the number of units is different for men and women because of the way that women metabolize alcohol. We metabolize alcohol differently, so that per drink we will have a higher blood alcohol concentration. Binge drinking is particularly important in the 16 to 24-year age group. Moving into alcohol dependence, this can develop insidiously, although some people with a genetic vulnerability may develop it at an earlier stage. Generally speaking, what happens is somebody's drinking heavily, they begin to become more tolerant to alcohol, to drink more, and there comes a point where they realize they can't stop drinking once they have started, and they continue to drink despite persistent harm. And there actually are questionnaires now that can be used in the workplace to help employers look at this type of drinking. going back then to the triangle on its side, showing that actually it's largely with hazardous, harmful drinking that the workplace can begin to intervene. How can you start the conversation? As Don showed with Amber, the confrontation didn't help. And of course, Amber was a very good worker. She was probably very ashamed that she'd been caught drinking. And there was something, perhaps the line manager could have praised her and said, we really value you, Amber. We want to keep you. How can we help you? That might be a way in. However, there are questionnaires which help to identify, and the audit questionnaire is a 10-item questionnaire which could be used pre-employment or as an assessment tool in the workplace. This could be available, perhaps the workplace might take on something like the alcohol concerns dry January, or bring in someone to talk about alcohol awareness as part of health and lifestyle. And there are 5 questions here. The first 3 is the 6 questions on this slide, and the first 3, as you can see, are to do with consumption, but the others are quite interesting. The 6th one is, how often during the last year have you needed an alcoholic drink in the morning to get yourself going after a heavy drinking session? That will begin to pick up somebody who is dependent. So your score here, the maximum score you can get is 40. And as you can see on this slide, if you score less than 7, you're at low risk, increasing risk 8 to 15, and 16 to 19 high risk. You're getting into possible dependence at 20. I recently had a young doctor come to see me at the practitioner health program, and at the end of the interview she said, you know, I did an audit on myself and I scored 20, so I guess I'm pushing into dependence. Alcohol dependence, but was able to stop drinking. Another question which might be helpful is this single alcohol questionnaire, which helps people to identify whether or not they're binge drinking. So screening and brief intervention in the workplace also calls identification and brief advice. Evidence, the research evidence, suggests that screening and brief intervention are effective in reducing alcohol consumption in the workplace, particularly when done in combination with routine health and lifestyle examination. And increasingly web-based interventions are excellent. They're acceptable, they're confidential, they allow good penetration, and they're very cost-effective. And just bringing up the conversation, you may be able to signpost people to good web-based interventions, such as are provided by NHS Choices, or the Alcohol Learning Centre, or indeed Don's Alcohol Health Network. Brief interventions are also done in other settings, including primary care, the General Hospital in A&E, and colleagues at the Institute of Psychiatry, Psychology and Neuroscience have recently shown that just a simple audit questionnaire, feedback, and a short information leaflet did as well as 20 minutes of counselling. So the workplace is a setting where this could be done. And the brief intervention, what is composed of a brief intervention is essentially feedback. The acronym FRAMES actually is very helpful. Feedback, helping the individual to take personal responsibility for change, signposting them to advice, giving them a menu of alternative strategies. And these are available on all the programs that are accessible on the internet. Don mentioned delivering the intervention in an empathic and non-judgmental way, and this is really key. And what one wants to do is increase self-efficacy of the individual so that they realize that they are a key person in the organization and are needed and valued. So employers. Well, employers have a duty under the Health and Safety at Work Act to ensure health, safety and welfare at work of employees, and it would be helpful for all employers to have a drug and alcohol policy. It makes it then clear for employees. Managers should be trained to recognise the signs of alcohol and drug use and know what to do, how to signpost if a problem arises. And again, I mention here, don't forget the GP is very often in general practice, in primary care, alcohol and drug use should be considered a health problem and dealt with confidentially. In that way, you help your workforce and you then build up actually a group of people within the workforce who could buddy and help the next group of people coming in with problems. And it's talked about openly. People don't have to divulge everything. But if Amber, in 2 years or 5 years down the line, is an exemplary employee and has overcome her alcohol problem, then she may be the first person that her boss will go to. Thank you very much.
Fantastic, thank you, Jane. That was very interesting. As before with Don, we will be taking questions. So if you have any key questions for Jane, or in fact for Don as well, then please do send those through. I think really just one of the observations that I made whilst you were talking through your slides, Jane, was that 40% of accidents at work involve or are related to alcohol. And that really surprised me as a statistic. You've obviously talked about the employer's role, particularly under health and safety legislation. I mean, do you have any particular sort of top tips or additional observations around that? Because I think that's quite a significant statistic.
I think it is a significant statistic, and of course if there is an accident at work, there generally will be some sort of investigation into the accident. Alcohol may come up in a very obvious way, and that's maybe a way into a conversation. Of course, you don't necessarily want to have a blame conversation. It depends on the severity of the accident. And of course, what we want to do is avoid accidents at work. So one way, if an organisation were having a run of accidents, they might then get together and decide what they're going to do about it. Look at what the core issues, and try and get people on board with some learning about how to avoid accidents. So an accident is actually a good way. And of course, if you look at the alcohol and drug literature, all too often it is accidents that drive change. They drive change in the aviation industry, in the transport industries. But you want actually to try and preempt accidents. You want to prevent accidents if possible.
Interesting. And you obviously mentioned the alcohol concerns Dry January.
Yes.
Health promotion that is a great way. I mean, obviously we're coming up to Christmas now. After Christmas we have the new year, so there's a real opportunity perhaps for 2015 for people to try that out in their departments, in their workplaces as well.
I think that is very interesting, and what I when I'm teaching students and medical students, I always also suggest that they keep their eyes, they read newspapers. And what is interesting, I have found with the Dry January, is it engages people to talk about it. And you have then role models, journalists who will admit that they've cut down and they've decided, well, actually, I've not only cut down, I've stopped. And I certainly know of 2 quite well-known women journalists over the last year who stopped drinking completely and were very open about that.
Be used for Amber, and as you say, in 2 to 5 years' time, once she's perhaps overcome her alcohol problem, she of course can be a role model in her workplace. So there's somebody that's slightly closer to home to support others from her experience, but also a role model, as you say. One of the areas that you also raised is around individuals making a personal difference themselves and taking responsibility for their own health, particularly in relation to alcohol. I mean, do you have any particular top tips as to how they might approach that, particularly in those environments where they may be a student, they may work in a city, those environments where there is high alcohol consumption? What can an individual do to help themselves in that sort of environment?
I think the first thing is to be aware. I think awareness and observe how much they're drinking themselves, and they don't necessarily need then to be slavish about telling other people what to do. But if they can cut down, maybe start going to the gym, maybe begin to eat more healthily, people might say to them, "Oh, you're looking really very well," and they might say, "Well, actually, I didn't like the Friday night binging, so I've stopped doing that, and I'm going to the gym, and I feel very much healthier, and I'm better able to do my work." So they begin to get the way. I think all too often you hear young people bragging about, I drank a bottle of wine on a Friday night, and this individual might then feel able to say, "Well, I used to do that, and I don't do it anymore, and I find I'm better, and I prefer not to drink in that way anymore." And just to not to be too evangelical about it in a way, but to begin to incorporate it into their into their daily work. And of course, as they then go out and are asked, "Oh, go on, have another one," they've got to do it and learn to say in a very nice way, "Well, actually, no thanks, I've had enough now." And bit by bit, actually, that then begins to change a perception. And if then when there are things like dry January, there is evidence then from, I think it was at UCL, a couple of scientists last year monitored themselves over the dry January and found that they lost weight, that their liver scans improved and their sleep improved. And there is all sorts of interesting evidence out there if you begin to look for it in relation to health and well-being. Too many people are feeling unwell because they're drinking too much and they don't realize it.
Fantastic, thank you. Over to Don, I know you had a
I
response.
think a really interesting thing that happens when you have alcohol awareness campaigns in workplaces is that people actually begin to discuss amongst themselves quite openly how much they drink, how it's impacting on their health, on their sleep and their weight and so on. And especially when people start to use some of the audit tool, the sort of self-assessment questionnaires that Jane was talking about, they begin to get a bit of an insight into how much they're drinking. And the usefulness of some of these tools is that you actually get a score which tells you whether you're low risk or increasing risk or high risk. And that can be a conversation starter. We've found when we've worked in different organizations that people tell us they start to compare themselves and compare with each other quite openly. And it's not done in a stigmatizing way. It's almost done in a, "Gosh, I didn't realize this, and what did you score?" And it just opens up a conversation. I think that's really what we're looking for, is an ability for people to start talking openly about their alcohol consumption, how it's impacting on their health. And then maybe looking at, well, we don't have to always go out to the pub to have a drink after work. Let's do something else possibly, or let's have a cup. It just begins to open up the whole sort of conversation. I think having alcohol awareness campaigns in workplaces is a way to get those conversations going, I think. And I think, as Jane said, if you can integrate those into a wider health and wellbeing framework, such as around exercise, nutrition, diet and so on, alcohol is a sort of a natural sort of fit within that, because because of the connection between drinking and weight gain, for example, or drinking and sleep loss, for example, and drinking and stress. So I think alcohol is a very natural fit within the health and wellbeing program, and I think it's employers have a great opportunity to raise the health and wellbeing of their workforce using alcohol awareness campaigns in general.
Fantastic, thank you, Don. I've got a question here from Celia regarding risk. When
Well, I think if there's clearly if there is certainly a safety issue, then quite clearly the employee needs to be told, look, this is a safety issue. And this is where having a policy is really, really important, because if the policy states that it's unacceptable to drink at work, and if there's a, if there's an issue to do with health and safety, then the employer is duty bound in terms of acting on it. Don't forget health and safety at work insists on this. So I think there's in safety critical situations, that's an absolute must. But it may well be that the employer needs to take action because work performance is being affected, and I think that's where the employer might have to say, look, I'm sorry, but I'm going to need to sort of discuss this with some of my colleagues, and that's where confidentiality might have to be broken. But again, a policy should state out in what circumstances confidentiality should be broken.
I think absolutely in safety critical situations, and that might be driving jobs. It certainly might be, definitely be in the nursing, healthcare, medical professionals. Certainly in pilots, it's really very important. And very often, what will happen is that the individuals say, "Well, actually, I'm relieved. I just couldn't deal with this myself, and now that it's out in the open, I think I can deal with it." And you want that conversation to happen before there's an accident or something awful happens. So and with appropriate support, that person can be helped and helped become abstinent or whatever is needed, and get them well again and back into the workforce. And we certainly at the practitioner health program see about 80% of us dentists with alcohol and drug problems recovering and getting back to work. Sometimes you have to invoke in the safety critical professions the regulatory body, particularly when drugs are involved, and we would usually have to involve the general, for doctors and dentists, the GMC or the GDC if drugs are involved.
Fantastic, thank you. Passing back to Don.
Well, no, just to come in there. I mean, I think there's a really interesting example here with Transport for London, for example, who are one of the pioneers in terms of this approach. They set out very early on their policy, quite pioneering policy, which was that if employees come to them, the employer with their concerns around their drinking, they will be thoroughly supported to overcome those difficulties. And what TfL have found, and they've researched this, is that those people who do come forward with the drink problem or an alcohol or a substance misuse problem do better. Get back into work, are able to sort of have some time out, but get back into their work, and they drum home that policy and that ethos to their workforce, and whether it's mental health problems or alcohol problems or drug problems. Their employees know that if they come forward, they'll be supported. And I think that just creates a very different culture than leading to the sort of situation you're talking about, where, or the question it comes from in terms of that there's a problem and confidentiality. In terms of trying to sort of really push home the message that you can get support. There's really good evidence on the sort of in terms of alcohol treatment and alcohol treatment research, that those who want some support and get that support do much better than those who don't get that support. So they do really well when it comes, treatment really works for people.
And that's really very important, and I've seen that operating not just in the TfL world, but in other worlds. As soon as there is that culture change, people will come forward out of the woodwork because they see that people have been helped to into recovery and they haven't been dismissed, and they say, well, maybe perhaps if I come forward and divulge my problem, the same will happen to me. And I think it really is a wish for everybody.
Thank you both very much. I think that's a really good place to end there. I mean, thank you all for participating, both Jane and Don, in terms of presenting your presentations, but also answering the questions that have come through from our audience. And thank you to our audience as well for your engagement in the subject area. It's something that's clearly very important, and there are obviously some really quick wins, as Jane has referenced at the end there, that can make a difference to individuals and also their. Moving on to some of the sort of final formalities to keep to time. In terms of the webinar itself, we certainly would like your feedback, so please do keep sending that through. You'll also find in the top right-hand corner the opportunity to rate the webinar as well, using a simple star structure, so please do that and let us know your thoughts. We would like to let you know that this webinar is a precursor towards our Why Mental Health Matters conference that is taking place on the 23rd of January 2015. We held our first conference for HR practitioners in January of this year, and it really was a very successful launch of our mental health and wellbeing conference portfolio, and received some excellent feedback from many of the 80+ attendees who participated. So we're very excited to announce our second conference next year. This is designed as a follow-on from the launch event and is being developed to continue the conversation and to address the areas raised by our attendees at the previous event. We'll be looking at a dynamic and hands-on day with workshops and case studies, which will provide line managers, HR managers, and also senior decision makers with practical tools and techniques to take back into the workplace. You will see there on your screen the learning outcomes that we're hoping to achieve. You'll also see the exclusive discount code for those of you that registered for this webinar to utilise to get the conference at nearly half price. So please do validate that before the 3rd of December. A couple of other areas to mention as well. As I mentioned at the very beginning, Maudsley Learning is part of the King's Health Partners family. And within that family we have King's College London's Institute of Psychiatry, Psychology and Neuroscience. And they have recently launched a MOOC, which is a massive open online course around understanding drugs and addiction. And this was created by Dr. Kyle Dyer, who I understand is listening, so I shall make sure that I explain it properly. In this MOOC, Kyle Dyer has examined the biological and psychological development of drug addictions and presented world-leading research in methods of clinical and social treatment and prevention. The registration for the MOOC is actually closed currently, but we can obviously connect you with Kyle, and likewise if you'd like to connect with Jane and also with Don, then we'd be happy to refer you on. But that's another opportunity to gain further information. And it would be remiss of me to not also mention Maudsley Learning Online, which is our digital platform which will provide information and also further learning on addictions. And a copy of this webinar and all the associated material can be accessed through there. So thank you again to Jane and to Don, and also to those of you that have participated. And we look forward to seeing you in January at the conference and of course our next webinar. Thank you very much.